Cytokine release syndrome is a known complication of chimeric antigen receptor T-cell CAR T-cell therapy, as is neurotoxicity and cytopenias. And now we know, because of the strength of evidence from our CD19 colleagues, that this is expected but also manageable. And I really am so grateful to all of our colleagues in CD19, because from them we've learned how to manage it, and we've learned a couple of things. One, that it's never too soon to try to jump on symptoms and try to treat the CRS, because we never want anything bad to happen to our patients. And two, that myeloma may not be the same thing as lymphoma or leukemia when it comes to things like neurotoxicity. Thankfully, we've been able to learn from the experience of others and also be able to see the new recommendations from our Society of Transplantation and Cellular Therapy, so that we can all be on the same page about grading and treating both CRS and neurotoxicity. I think something else we're going to be learning more about is the macrophage activation-like syndrome, not an official true MAS, but something like MAS, and how to treat that. And I think the more experience we have, we're going to be able to come together, even as a myeloma community in CAR T, and make recommendations for that.